I want to start today with a linguistic puzzle. It's a bit of a mystery, actually.
Oh,
Usually when we see a political movement or, an advocacy group evolve, the language gets simpler.
right. Punchier.
Exactly. It gets punchier. You start with some complex grievance, and you boil it down to, what, 3 words that fit on a hat or a sign?
Yeah.
Lock her up, defund the police.
Read my lips.
But
That's the standard trajectory. You refine the message until it's a weapon.
yes, you strip away all the nuance to maximize the impact. But the source material we're looking at today, it does the exact opposite.
It flips the script.
It really does.
Right.
We're tracking a movement that started with a slogan that, it sounds like a horror movie title, Free Kill.
Mm.
And then, over the course of 6 years, they voluntarily abandoned it for a phrase that sounds like a chapter in a civic engineering textbook,
Which is,
the accountability gap.
it is a counterintuitive shift. You don't usually trade a Ferrari for a minivan if you're trying to get attention.
Right. Free kill is so visceral it grabs you by the throat. The accountability gap sounds like something I'd scroll past on LinkedIn.
Uh-huh.
So the question for this deep dive is, why? Why would an activist take their most effective weapon and just retire it?
It's a great question. And the answer, based on this retrospective analysis we're digging into, it isn't about marketing. It's about mechanics.
Mechanics.
Yeah. We're looking at a 6-year journey of a citizen lobbyist in Florida fighting for medical malpractice reform. And what we're really seeing is a shift from performative outrage to what the author calls structural diagnosis.
So we're looking at how a movement grows up, essentially.
Or maybe how it wakes up.
Really?
Wakes up to how the system actually works. It's a move from shouting at the building to, well, to studying the blueprints.
Okay, well, let's look at the blueprints then. To get why the language changed, we have to understand what they were fighting. The timeline starts in May of 2020.
This is the catalyst. The author describes the death of their mother due to medical negligence in a Florida hospital. We don't need to go into all the specifics, but the outcome was a wrongful death.
And usually in the American system, if someone causes a wrongful death through negligence, the family has a clear recourse.
You sue.
You sue. You seek damages. And it's not just to get paid, right?
Right.
It's to hold the other party accountable.
Correct. That's the basic social contract in civil law. But this activist, they ran into a very specific, very weird wall. Florida statute 768.21, subsection 8.
Section 8, this is the villain of the story.
Well, depending on your perspective, yes. This statute is unique to Florida. Essentially, it says that if a person dies from medical negligence and that person is an adult over 25 and they're unmarried and have no minor children, then nobody can sue for pain and suffering.
So if you're a 26-year-old single guy,
Yep.
or a 60-year-old widow whose kids are all grown up, you're in this category.
Exactly. The hospital could, in theory, admit to the mistake, but the law just says, sorry, you don't fit the criteria for a claim. The case is dismissed before it even starts.
And that brings us to that first slogan, Free Kill.
It's the term the movement adopted almost immediately, and, you can see why.
It's brutal, but isn't it also kind of accurate? If I'm a doctor and I know a patient falls into this subsection 8 category, and I make a mistake that kills them, I pay zero. My insurance pays zero. That sounds like a free kill to me.
Emotionally, it's 100% accurate. And as a rallying cry, it was incredibly effective. The source notes that this phrase galvanized people. It made the news. It fits on a bumper sticker.
It implies the state has basically issued a hunting license on single adults.
Exactly. But the author eventually ditched it. And I have to be honest, reading this, that felt like a mistake. You have a slogan that works. Why get caught up in semantics?
Yeah.
Because the semantics are where the solution lives. The author realized that free kill was creating a false target. Technically, the state didn't legalize homicide.
Meaning the doctor could still go to jail.
In theory, yes, if it was, criminal gross negligence. And the doctor still had a professional duty of care. The law didn't say, you are allowed to harm this person.
It said,
if you harm this person, their family cannot use this specific tool, the civil lawsuit, to punish you.
that feels like a distinction without a difference to the grieving family, though.
To the family, yes, absolutely. But to the legislator you're trying to convince, it matters. A lot.
How so?
If you walk into a senator's office screaming, you legalized murder, they can just look at the statute and say, no, we didn't, next meeting.
Ah. So free kill was easy for them to dismiss because it was hyperbole.
Precisely. It captured the feeling of the injustice, but it lied about the structure of the law. And if you want to change the law, you have to speak its language. You can't just scream at it.
So this leads to phase 2. They retire free kill, and roll out legalized negligence.
Which is a huge step up in sophistication. Now we're moving from a horror movie title to like a behavioral economic theory.
It definitely sounds more systemic.
It is. The argument shifted to incentives.
Yeah.
This is where the source material gets really interesting about feedback loops.
Okay, break that down for me.
Yeah.
How does a feedback loop work in a hospital?
Well, think about aviation. Why are planes so safe? It's not just that pilots are good people. It's because if a plane crashes, the airline loses a massive amount of money, reputation, maybe its license.
Right.
There is a brutal, immediate feedback loop that makes safety the #1 financial priority.
It's expensive to crash a plane.
Very. Now, apply that to the free kill category in Florida. If a hospital kills a patient in this category, what is the financial cost?
0.
So the feedback loop is severed. The author argues that legalized negligence describes what happens when you remove the penalty. Institutional inertia just takes over. It's not that doctors are waking up wanting to hurt people.
No.
It's that the hospital administrators stop approving the budget for that extra nurse, or they stop updating the safety protocols.
Because there's no financial gun to their head.
Correct. When you remove the risk of a lawsuit, you inadvertently subsidize sloppiness. You are, in effect, legalizing negligence by removing the cost of being negligent.
This makes so much sense to me. It's the speeding ticket logic. If you remove all the speed cameras and fire the traffic cops, you've effectively legalized speeding, even if the sign still says 55.
That's the perfect analogy. And for a while, this was the framework the movement used. It connected the personal tragedy to a broken system.
They dropped this one, too.
They did.
Why? I mean, legalized negligence seems bulletproof. It explains the problem, the incentive structure. What was the issue?
Use that word again, legalized.
The author points out a really rigorous, almost annoying level of intellectual honesty here. They realized that negligence wasn't technically legalized.
Oh, come on. Again with the splitting hairs.
It sounds like it, but it's not just splitting hairs. The author realized that saying it was legalized implied the problem was permission. But the problem wasn't permission. The problem was enforcement.
Okay, unpack that. If I say negligence is legal, it implies the law changed to say bad medicine is okay. That wasn't true. The law still said bad medicine is bad. The failure was that the mechanism to enforce that law, the bridge between the injury and the justice, had been blown up.
This brings us to the final evolution, the accountability gap.
Yes, this is the mature framework.
Describe the visual for me, because the source describes a logo that goes with this.
Imagine a bridge with 2 pillars. The pillar on the left is injury. The pillar on the right is law.
Okay.
The span connecting them is accountability. It's the mechanism, the lawsuit, the settlement, the penalty that allows the injury to cross over and interact with the law.
Got it.
In Florida, for this specific group of people, the pillars are there. The injury is real and the law against negligence is real, but the span is just gone.
So you're standing on the injury pillar, waving at the law pillar, but you can't get there.
That is the gap. And this is where the deep dive gets a little gritty, because the source explains that the gap wasn't just about banning lawsuits, it was about the failure of the backup systems, too.
The backup systems?
Well, usually in society, we have redundant systems, right? If you can't sue a civil remedy, there's supposed to be an administrative remedy.
The regulatory state, government agencies.
Right. In Florida, you have the Department of Health and the Agency for Healthcare Administration, AHCA. Their job is to license and police the medical industry. The theory was, we don't need lawsuits because the state will do it.
Trust us, we're the government.
Basically. But the author's analysis shows a complete collapse of this administrative pillar. Over a 36-year period, these agencies suffered from what's called bureaucratic drift, or regulatory capture.
Regulatory capture, that's a polite way of saying the watchdog started working for the wolves, isn't it?
In a sense, the source highlights that these agencies are often funded by licensing fees from the very people they regulate. They're staffed by people from the industry. Over time, their mission shifted from protect the public to educate the provider.
Give me an example of what that looks like in practice.
So a complaint comes in. Dr. Smith operated on the wrong leg. A functioning regulator would investigate, fine, maybe suspend the license, but in a captured agency, the process is designed to dismiss.
Oh.
The complaint gets filed away. The review board is comprised of other doctors who sympathize with Dr. Smith. The punishment ends up being a letter of concern that goes in a private file nobody ever sees.
So the accountability gap isn't just I can't sue, it's I can't sue, and the police aren't coming, and the regulator's out to lunch.
Exactly. It's a total systemic failure. The gap is the void where all the enforcement mechanisms used to be. And the author argues this is a much more powerful diagnosis than free kill because it's not just about one bad statute.
It's about a design flaw in the state itself.
Yeah.
It's interesting because accountability gap is, well, it's boring, but it's universal. You could apply that to anything.
That is the whole point. The source explicitly mentions this. This isn't just about medical malpractice anymore. Think about police misconduct.
Okay, right. Injury happens, law exists, but qualified immunity prevents the lawsuit. Accountability gap.
Think about environmental pollution. A factory dumps sludge. It's illegal. But the EPA is underfunded, and the fines are cheaper than proper disposal.
Accountability gap.
It's everywhere.
So the author moved from a slogan that worked for victims to a diagnosis that works for citizens.
That's a fantastic way to put it. Free kill is a victim's cry. The accountability gap is a citizen's assessment. And that shift is crucial for what comes next.
Which is the pivot to action. We're in 2024 now in the timeline. The author has this diagnosis. They have the cool logo. What do they actually do with it?
This is the part that might frustrate some listeners who, want a revolution. The author pivots to stewardship.
Stewardship. It sounds quiet.
It is quiet. The source material contains this realization, and I'm quoting here, "Our republic does not repair itself. Citizens repair it." The author argues that screaming at the other side, the free kill approach, it actually widens the gap.
Because it just polarizes the room.
Right. If you walk in screaming murderer, the doctors and insurers and legislators, they lock the doors. You get zero engagement. The gap widens.
But let me play devil's advocate. This engagement approach, sitting down at the table, it sounds nice, but does it work? You're asking a grieving family to sit down with the insurance lobbyist who's paid $1 million a year to deny their claim and just talk.
It is an immense ask. The source definitely acknowledges how hard that is, but the counter-argument is, what's the alternative? They tried screaming for 20 years, it changed nothing. The legalized negligence phase changed nothing.
So the strategy is, if you can't beat them, force them to help you fix the bridge.
In a way. The author uses this analogy of a table with 4 legs. Patients, providers, payers, that's insurance, and policymakers. If any one of those groups refuses to sit at the table, the system collapses.
The table wobbles.
Yeah. The author's new mission is to create a space where the goal isn't to win the argument, but to restore the span, to get everyone to agree on one basic premise. Injury and law should be connected.
That seems like a premise everyone should agree on. Even a doctor doesn't want to work in a lawless system, right?
You would hope so. A good doctor hates a bad doctor more than anyone because it ruins their reputation. But the current system protects the bad doctor. The accountability gap invites the good doctors to help fix the architecture so the bad doctors can be weeded out.
It changes the dynamic from patients versus doctors to everyone versus broken architecture.
That is the core philosophy. It's moving from a combat mindset to a construction mindset. Restoration, not revolution.
It's a surprisingly conservative idea, structurally speaking. Let's make the institutions work the way they were designed to.
It is. It's deeply rooted in the idea of the constitutional republic. We aren't trying to burn down the hospital. We're trying to fix the feedback loops so the hospital is safe.
So this initiative is launched. They're inviting people to join. But who are they inviting? Just other victims.
This is the most surprising part. They aren't just inviting other victims, they're explicitly inviting skeptics.
Come argue with us.
Basically, the invitation is, stand at the edge of the fractured bridge with us. They want the doctors. They want the people who think tort reform is a good thing. They want the skeptics to come and look at the blueprints.
Because if you look at the blueprints, you can't deny the gap exists. You can argue about how to fix it, but you can't argue that the bridge is whole.
Exactly. Once you agree the bridge is out, you're no longer fighting about if there's a problem. You're collaborating on how to solve it. That's the genius of the rebrand. Free kill invites a fight. The accountability gap invites a project.
It's really a lesson in patience, isn't it? I mean, dropping the emotional hook for the intellectual anchor, it's risky.
It is risky. You lose the viral Twitter moments. You lose the people who just want to be angry. But the author is betting that the people who remain are the ones who can actually rewrite the statute.
Quality over quantity of support.
Stewards, not spectators. That's the term they use. A spectator watches the car crash and yells. A steward gets out of the car, directs traffic, and calls the paving company to fix the pothole.
I think that's the challenge for all of us today. It's so easy to be a spectator, especially with algorithms feeding us outrage bait every 5 seconds. Free kill is perfect for the algorithm.
But the accountability gap is perfect for the statute book, and we have to decide where we want to live. Do we want to live on Twitter, or do we want to live in a functioning republic?
That's the question. And as we wrap up, I want to bring this back to you, the listener. We've spent a lot of time in the weeds of Florida law today. But as you said, the gap is everywhere.
Anywhere injury and law fall out of alignment.
So here's my challenge to you listening. Look around your own life, your workplace, your homeowners association, your city council. Where do you see an accountability gap? Where do you see a rule that exists on paper, but in reality, there's absolutely no mechanism to enforce it?
And when you find it, and you will find it, what are you doing about it? Are you just complaining about the free kill? Or are you trying to understand the architecture that allows it to happen?
It's not as fun as yelling slogans. It requires reading boring documents and understanding bureaucratic drift. But it might be the only way to actually fix anything.
Engagement repairs. Silence preserves.
We'll leave it there. Thanks for diving deep with us into the anatomy of the accountability gap. We'll see you next time.